Hi there. I'm Dr. Hackin. It's such a pleasure to meet you. I understand that we're here for a little checkup today. Okay, great. We can definitely handle that here. That's one of our specialties at Hackin Medical. And I also understand that you're going to need some forms signed off for an employer that you've gotten a little checkup. Is that correct? Okay, I can definitely do that. I love giving a little autograph, so that's not going to be a problem. Now, I know that you've already answered all of these questions for the nurse, but I do have to ask you every single one of them again. It's just procedure, policy, the law. It's not up to me. If it were, I would say, oh, I already have this information. The nurse already asked you these questions, and I don't mean to be dismissive by saying the nurse. I don't know if you caught her name, but she's fabulous, Miss Cooper, Nurse Cooper. Whew, what a woman. Anyways, let's just get started with these questions, and then we can get your checkup done, have a little exam. All right. Are you on any medications right now, sweetheart? Okay. And that includes Seroquel, gabapentin, gummy vitamins, hair vitamins, collagen supplements, the like. All right. Do you have a family history of any medical issues? Diabetes, stroke, cancer, thyroid disease, Parkinson's, things like that? Okay. And is that on mom's side or dad's side? Okay. Okay. How often do you drink alcohol? Once a week, every day, a couple of times a day? Maybe it's 5 o'clock every day, all day at your house. I'm not judging, I'm just asking. Okay, does that include brunch? Does that include mimosas? Just had to ask, because I know a lot of people, particularly where we live, like to dismiss a mimosa and call that juice. All right, let's see. All right. Have you had any surgeries in the last couple of months? Actually, let me be more specific. Have you had any surgeries in the last year? Okay. No surgeries. Any hospitalization for any reason? Any ER visits? Did we tweak anything to the point of an ER visit, maybe? Okay, good. All right, let's talk about tobacco. Do you use any tobacco products? We're talking cigarettes, cigars, snuff, dip, hookah, vape, hand-rolled cigarettes. American Spirit counts too. Okay, good on you, good on you. Good, yeah. It is usually people a little bit younger than you that I see doing a lot of tobacco. I tell you what, I didn't see any tobacco really from the young people from about, I'd say, 2005 to like 2010. Those young people dare drugs resistance, alcohol education had a lovely effect on those young people, and they weren't smoking anything. I can't say the same for Generation Z, but I do not blame Gen Z for that. I don't blame them at all, because the advertising on Instagram, it's a huge problem. Okay, all right, that's my soapbox for today. Yeah, forgive me. All right, let's talk about drugs. Okay, recreational drugs. We're talking acid, Blue Lagoon, Spike, Spitz. If we're doing any snappers, bath salts, shower steamers, anything like that. Good on you, and that's good. And, I'm not judging, but this includes any recreational drug use at maybe a music festival, Coachella, stuff like that. Okay. My son went to Coachella, and I swear I almost had a heart attack. No history of heart attack in my family, thank God, but, my left arm started hurting, and I was like, oh no. Sometimes even as doctors, we can be susceptible to medical overreaction, but I was freaking out when my son was at Coachella, because I know about the music festivals, I know about the recreational drug use, but he's a good boy, and he's a big boy, he's a grown adult man, so I can't really control him all that much. Okay, now we've talked about kind of some harder recreational drugs. Let's talk about the devil's lettuce, okay? Have you been known to dabble? It's totally legal in a lot of places. It's legal here. I'm not judging if you do dabble. I would just love to know that. Okay. Are you sure? Not even a little wacky tobacco on the weekends? No, all right, okay. I'm nosy, it's my job. All right. Let's talk a little bit about mental illness, family history of mental illness. I'm talking depression, anxiety, bipolar, a little schizophrenia. If any of that's going on in that family history, I'd love to know. Okay. Mom's side or dad's side? A twofer. Yeah, that's okay. Are you currently suffering from any mental health issues? I'm talking depression, anxiety, bipolar disorder, schizophrenia, anything like that? Yeah. Yeah, that's okay. Show me someone without a little bit of anxiety these days, Okay. How's our diet? Are we eating regularly? Are we getting 3 meals a day? Are we getting some good protein, some good fibers, some good fats, some good grains, etc. in your diet? Are you familiar with the My Plate model? Okay, good. Okay, good. Okay, let's talk about exercise. Do you exercise at all? I'm talking taking the dog out, swimming in the sea, b-ball with the homies certainly counts, taking those stairs 2 at a time, wrestling, bobsledding, tennis. Okay. Okay. All right, how's your sense of smell? If I were to pass a little Zaxby's zesty fart right now. How close to me would you have to be to smell it? 10 feet away? 10 inches away? Have you noticed any loss of smell over the last couple of years? Okay. All right, how's our hearing? If I were being sassy, talking crap, how far away would I have to be from you for you not to hear that? Okay. All right, how's our impulse control? Are we engaging in any risky behaviors? Are we gambling? Are we, I don't know, taking the car out at 2 a.m. to drive to the Costco and sit in the parking lot because you just feel the urge? Is stuff like that happening? Okay. Okay. Are you currently experiencing any pain today, including but not limited to sprains, breaks, tummy cramps, Charlie horses? Have you hit your funny bone in the last couple of hours? Gas bubbles that make your tummy feel like a balloon? Itchiness, stinginess, burning. Yeah. Anything. Headache, migraine, sensitivity to light. Okay, good. Any cough, any sneezing lately? Okay, good. And is there anything that's been bothering you lately that you would like me to make sure I check on? Yeah, I can take a gander at some moles. I'm not a dermatologist, but I went to medical school. I have basic knowledge of moles, and I would certainly be able to let you know if anything needed to be referred to a dermatologist for a second look. Okay. Yeah, I'll take a look at them. Okay, that's enough paperwork, am I right? Let's get started on that exam. Okay, first things first, I'm going to listen to that heart. Good. Go ahead and take a deep breath for me. In through that nose, out through your mouth. Good. Lungs sound good. Do me a favor and try to fill up that diaphragm. Fill that belly with air. Take a deep breath in through your nose. Fill the belly. Feel the belly expand. And exhale. Good. Give me a little cough. Fake it till you make it. I know you don't have a cough today. Give me a little fake cough. Okay, good. Everything sounds good in terms of the lungs and in terms of your heart. Excellent. Okay. Go ahead and look directly at the light for me. Good. Other eye. Good. Can you go ahead and follow my finger with your eyes this way? That way. Good. Up. Good. And down. Okay, we've got a little twitch going there. Is that usual for you, or is that just a fluke? All right, let's do it one more time just to be sure it's a fluke. Following my finger up, down, side to side. Good. Okay. All right. Let me take a look in those ears. Alright, this ear looks good. No major blockages. Maybe a little bit of waxy buildup, but that's just usual waxy buildup. Okay, looking good over here as well. A little bit of waxy buildup, but again, just the usual suspects. Okay, ears look good. Cold hands. I'm about to feel that neck. Okay. A little bit of fluid buildup in those lymph nodes, but that's totally fine. Normal. Maybe let's get your thyroid levels checked. So many people's thyroid levels are just not what we wish they would be. Okay. Neck and throat look really wonderful. I'm going to push on your tummy a little. I want you to tell me if you feel any type of discomfort at all, even the slightest discomfort. No pain, no discomfort there? Good. Okay. Excellent. Okay. Hold still for me. Okay. I want you to gather some saliva in your mouth. Alright, just kind of swish that around in there. Open up. Okay, your enzyme levels are normal, so that's great. Okay, this is going to be touching your neck a little bit, so just hold still. Your liver function looks good. I think you could maybe cut back a little bit on the ibuprofen use, if at all possible. We really don't want to be having more than 2 ibuprofen a week, I would say, for maximum. I mean, it's a case-by-case basis. If you're really in pain, you really have to take it. But if you're finding yourself in that type of pain when you're having to take ibuprofen every single day, that's a conversation we need to have, okay? Okay, open up under the tongue. Alright, slight fever today, 99.1. That's not really a fever as much as it's just the natural fluctuation of the body. I don't see anything to indicate that you're currently sick, so we'll just write that one off, I suppose. Okay. Sit up straight for me. Cardio rhythms are seeming on schedule, on time, so that's great. You're gonna feel a tiny pinch. Good, your reflexes are right on target. Excellent to see. 1 second. roll up your sleeve for me. Thank you. Let me do that one more time. Good. Blood pressure is right where we want it to be. Okay. Let's test for allergies. Hold still. Okay, so we're seeing a little bit of a reaction already on grass. You might have a little grass allergy. Okay, let's check this out. Charcoal looks good. Doesn't appear that you have a charcoal allergy. Lavender looks good. You don't have a lavender allergy. Water looks good. You're not allergic to water. Grass is a little foggy. I think that we might have an allergy to grass. What does that mean for your day-to-day? Not much, really. It just means don't take your shoes off and run through the grass. Wear shoes. Okay. You're not allergic to gluten, so that's lucky. All right. Slight lemon allergy. Have you ever felt yourself kind of puffing up after citrus? Yeah, that'll be that. Yeah, grapefruit doesn't sit well with you either. But you are just fine when it comes to Tylenol. And you are just fine when it comes to most antibiotics. So that's great. Okay, just a couple more tests to go. These aren't required by any medical board, but I do them because I think that they're helpful. This is just going to be testing for your radiation levels. You are just barely radioactive, which is where we want to be. That's where the rest of us are. Okay, great. I'm just going to be looking for the reactions of your facial muscles, okay? Good. 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 It looks like we don't have any facial paralysis, which is excellent. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9. Do these all look like a different color to you? Good. Color blindness, there's none of that. Your skin seems to be secreting all of the oils that it ought to be secreting at this time of day, so that's good. Let's test your blood sugar levels. Good, we're right in that normal range for all that blood sugar stuff. Okay, that was a lovely visit, I think. A lovely little checkup. I can definitely sign off on your forms, letting your employer know that you have had a checkup. You're good to go. Didn't see anything to be too concerned with. When you have a chance, I might want to get your thyroid levels checked out. I know that you didn't really want to do that today, but you know, if you ever experience a lot of fatigue, a lot of stuff like that, it's always worth getting those thyroid levels checked out. But again, our blood pressure was good. Heart rate looked good. Healthy enough to lift boxes, I would say, for sure, if you needed to. You're up to date on all of your vaccines, so you could visit a baby. The cholesterol's in a normal range. The diabetes is non-existent, so that's wonderful. Your shins look good. Your calves look good. The kneecaps look solid. The thighs look excellent. Your abdomen has the right level of firmness, which is a huge thing. I heard you pass gas earlier. I smelled it. It smelled normal. Good. I mean, smelly, but not, oh, she's suffering from an internal disease smelling. Your skin overall looks good. Those moles we talked about, totally normal. Abundant in number for sure, but totally normal. Nothing to be worried about. No melanoma. Yeah, so good. Your elbows look good. Your forearms look good. Those shoulders are right on target, exactly where we want to be. The sternum looks solid. It feels solid too. Your kidneys seem to be in the right place. Your gallbladder is there. As for the function of the spleen, I'm gonna call it average. Your nails look good, though that's just mainly a credit to your incredible nail artist. I'm not sure what the nail bed actually looks like. In fact, as much as I love the nail art, it does make diagnosing iron issues by sight a little more difficult. But based on your blood work, your iron's good. Your nose looks good. Your eyes look good. Maybe a tiny bit murky, but you know, that comes when you get to be 25. Your forehead looks good. The cranium, the size of the cranium is good. The size of the skull is good. The ears look good, a little bit waxy, but you know, nothing to write home about. Again, please do not solve that wax by digging in with a Q-tip. I'm begging you, absolutely begging you, don't do that. You can rinse it out. There's some tutorials I can send you. some YouTube tutorials on how to rinse out an ear with water and some hydrogen peroxide. But please don't go pokey stabby with the Q-tips. That is a one-way ticket to a perforated eardrum. And a perforated eardrum is disgusting. I don't know if you know that, but it's like oatmeal. Alright, I shouldn't have said so, but it is. As far as the heart, it sounds excellent. As far as the brain waves go, I have no way of measuring that in a simple checkup, so who knows. I think overall you look excellent. Okay, great. So I'm going to sign off on this. And I just want to remind you to like and subscribe. As always, that's so necessary. I am going to say that I recently reached 100,000 subscribers on YouTube, and I am thrilled. I am over the moon. I am so excited, and I'm so grateful, and I'm so thankful to all of you for making that happen. You've got this.